Congenital malformations represent a well-known public health problem worldwide. They are an important cause of infant and child mortality and disability worldwide, and they are the leading cause of infant mortality in Albania. Prior to 2009, among all diagnosed congenital malformations, were reported officially only 2 of them, spina bifida and congenital luxation of hip. So in 2009, we started the implementation of the congenital malformations surveillance system. Albania is the first country in the region to implement this system, and we improved and strengthened our congenital malformation surveillance system according to the recommendations of the WHO in the framework of Zika virus transmission. The aim of this report was to describe the prevalence of congenital malformations in Albania during 2011-2015 in order to evaluate and adapt antenatal programs. The objectives were as follows: to estimate the overall prevalence of congenital malformations by year, regions of Albania during 2011-2015, to describe the distribution of congenital malformations by different socio-demographic and birth-related characteristics during this period of time, and to estimate the prevalence of the most frequent type of congenital malformations in Albania during 2011-2015. This is a surveillance descriptive report, and we collected all the congenital malformations reported to our national surveillance system, and the number of live births were extracted from the database of the Ministry of Health. Our surveillance system covers all the districts and regions of Albania and all the public hospitals and primary healthcare centers of Albania. In the beginning of 2017, the private hospitals providing pediatric and obstetric gynecologic services started to report congenital malformations in our Institute of Public Health. This is a passive surveillance. It's a standardized reporting form. It's paper-based and it's mandatory reporting. In the case definition are included all those malformations diagnosed among live births, stillbirths, induced abortions, perinatal deaths, and children up to the age of 2 years old who are born or residents of Albania. We measure the prevalence per 1,000 live births of congenital malformations by year, type, gender, residence, and mother's age-specific groups, and we describe their distribution according to socio-demographic and birth-related characteristics. We use the term prevalence according to WHO and CDC guidelines on congenital malformation surveillance systems, although we refer to new cases over live births over a year. Here are some characteristics, birth-related characteristics of congenital malformation cases in Albania during 2011-2015. 89% of cases were born alive, 5% of them were reported as stillbirths, around 4% as perinatal deaths, and only 1.7% of cases were reported as induced abortions due to congenital malformation. The total number of reported congenital malformations was 2,679. 75% of cases had a normal birth weight, and 75% of cases were born on term. Here are some social demographic characteristics of cases in Albania during 2011-2015. 52% of cases were of urban residents. For 67% of cases, their mothers were unemployed. 98% of cases were Caucasian, but this proportion increased by 47% among Roma babies from 2011-2015, and 51% of mothers had less than 8 years of formal education. In this graph, we see the prevalence of congenital malformations in Albania by years. The total prevalence for the 5-year period was 14.4 per 1,000 live births. Trend analysis showed that there are small but not significant variations in the prevalence during these years. In this map, we see the prevalence of congenital malformations in Albania by regions of Albania, 12 regions. And the central and south of Albania had the highest prevalence of congenital malformations. And we believe that this is because of better reporting from central and south of Albania. The main regions, the main affected regions with a high prevalence were the region of Tirana and Gjirokastra. In this graph, we see the prevalence of congenital malformations by body system affected during 2011-2015. And the main most affected systems were musculoskeletal system, cardiovascular, genital, and digestive system, including oral cavity, with the prevalence of congenital malformations 3.3, 3.2, 2.2, and 1.8, respectively. The less affected systems were congenital anomalies of the integument and the respiratory system. In this graph, we present the prevalence of the most frequent types of congenital malformations in Albania during 2011-2015. The main congenital malformations were hypospadias, a malformation of the male genital system, followed by polydactyly and Down syndrome, with a prevalence of 1.11 and 0.89 per 1,000 live births. Except Down syndromes, all the 9 malformations belong to the most affected system, which were musculoskeletal, cardiovascular, genital, and digestive system. During 2011-2015, the prevalence of congenital malformations was higher among males than in females. The prevalence among males increased by around 7%, and among females decreased by 9% from 2011 to 2015. The prevalence of congenital malformations among babies born from mothers more than 30 years old was higher than the prevalence of congenital malformations among babies born from mothers less than 30 years old during the whole study period. In this graph, we see the prevalence of microcephaly in Albania by years during 2011-2015. The total prevalence for the 5-year period was 0.07 per 1,000 live births, and trend analysis showed that there are no significant variations in the microcephaly prevalence during these 5 years. We are facing also some problems. There is underreporting in some districts. We lack congenital malformations data from private sector up to 2015. For several years, there is lack of refreshed training for specialists and medical staff working regarding these surveillance systems in all districts. And we are missing data about risk factors in this report, and we are limited only to calculate the prevalence for live-born cases. This is the first comprehensive report detailing the live birth prevalence of congenital malformations in Albania. There is no increase in the prevalence of congenital malformations in Albania during 2011-2015. The number of births among women more than 30 years of age continues to increase, with 10% more from 2011 to 2015. The main systems affected were musculoskeletal, cardiovascular, genital, and digestive system, including oral cavity. And our surveillance system allows us to confirm the absence of an increase in the prevalence of microcephaly from 2011 to 2015. There is need to improve the reporting of congenital malformations surveillance system, to improve the reporting of congenital malformations from public and private sector, to investigate the reasons of the regional differences, to raise the public awareness about congenital malformations in Albania, especially targeting unemployed, older, and low-educated mothers, and to develop comprehensive approach in order to improve birth outcomes and to reduce the congenital malformations, to conduct further research about risk factors, and to evaluate our congenital malformation surveillance system according to WHO and CDC guidelines in order to improve antenatal programs. And thank you for listening to me, and I would like to thank all the team who is working for the congenital malformation surveillance system, our supervisors, national focal point, the scientific supervisor, and thank you.
Thank you, Dorina. Thank you very much. You're absolutely on time, very fluently presenting this very interesting issue. This is something which is really touching all of us, and it is a very big public health issue, trying to actually lower as much as it is possible the number of babies who are going to be born with malformation. I'm going to ask the audience if there is any question or comments related to Dorina's presentation. Yes, please.
Thank you very much for your interesting presentation. I'm interested in you said about risk group Caucasian population. Risk group Caucasian population. Have you some information about risk factor for this group?
Thank you for your question. The reporting form includes also information about risk factors, including infectious diseases, chronic diseases, lifestyle of the mother, information regarding medication that she took during pregnancy. But unfortunately, we lack this part. The doctors do not feel this part. They only feel the socio-demographic characteristics and some characteristics of the baby born with congenital malformations. So this is one of the limitations that we lack the risk factors. And we are working to conduct a study to know the risk factors.
Thank you very much.
Thank you.
Yes.
Thank you. Very nice presentation, thank you very much. It's just that I don't understand very well when you show the prevalence of the specific malformation is much, much lower than the overall prevalence of malformation at live birth. So I'm not sure that, because you mentioned 14.4
14.4, yes.
per 1,000, which sounds to me very high, and in the specific one is much, much lower.
Because I choose in the specific ones only the diagnosed. It is one by one because there are many, over 1,000 diagnoses, so I choose the 10 most frequent reported diagnoses. That's why. In total, congenital malformations among live-born cases were 2,384, but so I calculated the prevalence for the whole country, the national prevalence, and then the regional prevalence, and here is the prevalence for a specific diagnosis. So I choose the 10 most frequent diagnoses here. And in the graph above, all the systems, one by one.
Okay, so most of the time the specific malformation is not specified.
No, they are all specified. They are each malformation is specified by the diagnosis.
Okay, thank you. I'm not sure. We'll discuss after.
Okay.
Any other question? Yes.
Thank you for this very nice presentation. Just here a question. Comparing to other neighboring countries, what do you think about the malformations, congenital malformations in Albania compared with these regions? Thank you.
Yes, thank you. We have looked at the literature also, but compared to the neighboring country, we couldn't find the prevalence of congenital malformations for the whole country. They report for specific systems or specific malformations which refer to previous years, which I couldn't compare with our results.
There is a question behind.
Thank you, Dorina, for your interesting presentation. Absolutely a big problem for Albania, for all countries, these congenital malformations. You highlighted in your presentation that there is a huge variation in reporting quality between Tirana, capital, and other districts. My question is, how did the data from this surveillance system help you to raise the awareness of government or policymakers or Institute of Public Health in order for this to take measures to improve the quality of reporting from other districts as well? Because at the end we collect data to improve the situation. So this is my question. Did this data help you to take measures to improve the situation about reporting regarding birth defects in Albania? Thank you.
Yes, thank you. As I said, this is the first detailed report. This is a new surveillance system started since 2010, and these are the data for our system from 2011 to 2015. We are facing problems with underreporting, and Tirana has a better reporting compared to other regions of Albania, and we are working now to improve the reporting with public health district directories, which are responsible for the surveillance system in their districts, in order to improve the reporting in each specific districts.
Yes, please.
Thank you for interesting presentation. I want to ask you about if there is a modification of congenital malformation forms after announcement of Zika virus as a public health threats, including travel history to country reported the Zika virus?
Thank you. No, we didn't modify our reporting form. We strongly collaborate with the Department of Non-Communicable Diseases, and we have contacted and trained all the medical staff in all the hospitals of Albania, private and public also, that as soon as they identify microcephaly or another malformation of the central nervous system, they should immediately call the surveillance system and the non-communicable diseases department, and the team goes there and investigates the case. We didn't change the form of
Any
reporting.
suspected cases traveling, history of traveling?
They collect, the team collect information about the history, if they traveled or not. It's then a specific information which is in the Department of Non-Communicable Diseases, but we strongly collaborate with them.
Thank you.